Imagine sealing your lips before bed to stop snoring and sleep better. Trendy? Yes. Safe and effective? That is the big question. In this video, we dig into what doctors and studies actually say. We will unpack how mouth taping might work, what the evidence shows for snoring and sleep apnea, who should never try it, and what proven options work better. Disclaimer: this video is for education only, not medical advice. Stay to the end for a bonus section on safer, quick fixes you can try tonight. Supporters say mouth taping forces nasal breathing, which could steady airflow and reduce snoring. According to the Rhinology Journal, your nose warms, filters, and humidifies air, which can make breathing feel smoother and less irritating. Some advocates claim nasal breathing increases nitric oxide, which may help blood flow in the lungs. This idea is often discussed in otolaryngology literature, including summaries in the Egyptian Journal of Otolaryngology. A recent review published in PLOS ONE notes that keeping the mouth closed might also prevent jaw drop and mouth leak that can get noisy. The big takeaway is simple. The theory makes sense only if your nose is truly open. If your nose is blocked, forcing nasal breathing with tape can backfire. Next, let us look at what the physiology actually shows. When you sleep with an open mouth, airflow in the throat can speed up and pressure can drop, making the airway more likely to collapse. According to a computational fluid dynamics study published in the PLOS ONE journal, oral breathing increases airway resistance and collapsibility compared with nasal breathing. The Rhinology Journal explains that nasal receptors help coordinate a steadier breathing rhythm, which may support upper airway muscle tone. In short, nasal breathing tends to be more stable than mouth breathing during sleep. That is the rationale behind taping. Keep the lips together, encourage the nose to do the job. If you like evidence-based breakdowns like this, please consider subscribing now so you never miss our next deep dive. Up next, what taping can and cannot do. Here is the honest picture. According to the PLOS ONE systematic review, mouth taping may reduce mouth leak and snoring loudness in some people who mouth breathe. But the American Academy of Sleep Medicine guideline published in the Journal of Clinical Sleep Medicine makes clear that taping is not an established therapy for sleep apnea. For people with true airway collapse, positive airway pressure does the heavy lifting, not tape. Research published in the Annals of the American Thoracic Society also shows that addressing jaw position or using proven devices changes airway mechanics far more than sealing the lips. So, tape might help a narrow group, but it is not a cure. Let us see what the snoring studies actually found. A small pilot study published in Healthcare, the Basel journal, followed mild OSA mouth breathers and reported that snoring events dropped after a short period of mouth taping. The PLOS ONE review also highlights case series where partners reported quieter nights. These signals are interesting, but they are small, short, and not blinded, which the PLOS ONE authors caution limits confidence. Think of it like this. Taping can reduce noise if your main issue is mouth leak, but it will not fix deeper airway collapse. Next, when does taping fail to help? Not all studies show improvement. The PLOS ONE review notes several trials where snoring did not change in a meaningful way. In head-to-head comparisons, a study discussed in JAMA Otolaryngology, Head and Neck Surgery, shows that custom mandibular advancement devices often outperform simple hacks like tape plus nasal gadgets. The American Academy of Otolaryngology Head and Neck Surgery advises that better snoring outcomes happen when nasal obstruction is treated first, then the mouth issues. The lesson is simple. If your nose is narrow or congested, fix that upstream problem before thinking about tape. Now, does taping improve sleep quality and next-day function? People often say they feel better after taping, but subjective feelings can be influenced by expectations. In the Healthcare Basel pilot, daytime sleepiness scores improved, but there was no rigorous blinding. The PLOS ONE review points out that objective sleep metrics such as awakenings, sleep efficiency, and oxygenation rarely improve with mouth taping. There is also almost no data on memory, mood, or heart rate variability. You might feel calmer because you are trying something new, but the measurements that matter often do not change. Next, what about actual sleep apnea severity? In the Healthcare Basel pilot, People with mild OSA who mouth-breathed saw their AHI, said as AHI, drop about half after short-term taping, especially when their noses were clear. That is promising but limited. The study was small, lasted briefly, and focused on a select group. The PLOS ONE review emphasizes that we cannot generalize these results to moderate or severe OSA. In simple terms, mouth taping may help a mild mouth-breathing subgroup, but that is not most people with OSA. So what happens in more serious cases? For moderate to severe OSA, taping can be unsafe and ineffective. The treatment guideline published in the Journal of Clinical Sleep Medicine stresses that continuous positive airway pressure is the gold standard for significant OSA. Research in the Annals of the American Thoracic Society also shows that jaw and airway support, not lip sealing, determines success. If you snore loudly, stop breathing at night, or feel very sleepy by day, the Journal of Clinical Sleep Medicine recommends getting a sleep study before trying any do-it-yourself approach. Now, what about dry mouth and dental health? Mouth breathing dries the mouth and can irritate gums. The Rhinology Journal explains that nasal breathing humidifies air and helps maintain moisture. For people on CPAP who wake with dry mouth, sleepapnea.org, run by a patient and clinician group, recommends heated humidifiers, which often work better than tape for this problem. The PLOS ONE review found no direct trials showing that mouth taping prevents cavities or periodontal disease. If oral health is your main worry, focus on nasal care, hydration, and dental hygiene, and use CPAP humidification when appropriate. Next, let us talk about why nasal patency is the gatekeeper. If your nose is congested, has polyps, or a deviated septum, nasal breathing is hard. The American Academy of Otolaryngology Head and Neck Surgery advises starting with saline rinses, intranasal steroid sprays, or allergy management to open the nose. The PLOS ONE review cautions that forcing nasal-only breathing with tape can raise resistance and make breathing worse when the nose is not clear. The sequence matters. Open the nose first, then evaluate snoring. That is safer and more effective than sealing the mouth and hoping for the best. But what about skin and tape problems? Adhesives can irritate skin, especially with nightly use. The PLOS ONE review reports contact dermatitis, lip irritation, and occasional skin tears with various tapes, including so-called hypoallergenic and silicone options. Gentle removal helps, but sensitive skin may still react. If you notice redness, burning, swelling, or blisters, stop immediately and consider medical advice. Remember, a method that harms your skin and disrupts sleep is not a real solution. Now, the biggest safety concern? The airway. The worst risk is blocking your ability to clear your airway if you vomit or suddenly cannot breathe through your nose. The PLOS ONE review warns that taping can raise the danger of aspiration in rare but real scenarios. The Annals of the American Thoracic Society also emphasizes that any method that limits airflow is risky for people with lung disease or unstable breathing. Avoid taping if you have COPD or asthma, significant reflux, use sedatives or alcohol, or feel anxious when your mouth is covered. If you ever wake up choking or with oxygen drops on a monitor, seek evaluation first. Next, please do not try this with children. Mouth breathing in kids is a sign, not a habit to tape away. The American Academy of Otolaryngology Head and Neck Surgery notes that enlarged adenoids, allergies, or structural issues often drive mouth breathing in children. Taping could interfere with normal breathing and development, and there is no good evidence of benefit. Children with snoring or restless sleep should see an ear, nose, and throat specialist or a sleep clinician for proper evaluation. Now let us pivot to what actually works and is recommended. For sleep apnea, continuous positive airway pressure is the gold standard, as stated in the Journal of Clinical Sleep Medicine guideline. Custom mandibular advancement devices are also recommended for snoring and for mild to moderate OSA, again according to the Journal of Clinical Sleep Medicine. Research published in the Annals of the American Thoracic Society shows that positional therapy, which keeps you off your back, can help people whose events are worse when supine. These options change airway mechanics in ways that tape does not. Next, lifestyle and nose care that make all treatments work better. Weight loss reduces snoring and OSA severity, as emphasized by the Journal of Clinical Sleep Medicine guideline. Myofunctional therapy, which trains tongue and throat muscles, has supportive evidence for mild cases, also reported in the Journal of Clinical Sleep Medicine. If your nasal valve collapses, external nasal dilators have shown benefit in selected patients, as described in Archives of Otolaryngology. Head and neck surgery. Pair these with good sleep hygiene, side sleeping, steady schedules, and limiting alcohol near bedtime. Now, why do studies on taping disagree so much? The PLOS. One review explains the gaps clearly: tiny sample sizes, short durations, and no blinding invite bias. Different tapes and different tightness make results inconsistent. Many studies did not screen for hidden OSA or for nasal obstruction, so some improvements might simply reflect quieter noise, not safer breathing. Measurement tools vary too. Home devices and snore apps can miss awakenings and oxygen dips that full polysomnography would catch. This is why expert groups push for proven treatments. If you still plan to experiment, hear this first. Start by screening for OSA if you snore loudly or feel very sleepy. That is the clear advice from the Journal of Clinical Sleep Medicine guideline. Only consider a short, cautious trial if your nose is clear and you have no risk factors listed earlier. A point also stressed in PLOS ONE. Never tape when you are sick, congested, or after alcohol or sedatives. Use a gentle, vented design and stop immediately with any breathlessness, panic, or rash. Quick pause. If this evidence-first approach is helpful, please subscribe now so we can keep making balanced, doctor-level breakdowns for you. Next, your bonus. Safer, quick fixes you can do tonight. Sleep on your side and elevate the head of your bed. Positional strategies have documented benefits in supine-dependent cases, as noted in the Annals of the American Thoracic Society. Rinse with saline and consider an intranasal steroid for allergy season. That is standard advice from the American Academy of Otolaryngology head and neck surgery to improve nasal airflow. If snoring persists, talk to a qualified dentist about a mandibular advancement device. This is endorsed for snoring and for mild to moderate OSA by the Journal of Clinical Sleep Medicine. Now, let us wrap everything into a clear bottom line. Here is the bottom line. Mouth taping is not a treatment for OSA. A review in the PLOS. One journal finds limited and mixed evidence with real safety concerns. The Journal of Clinical Sleep Medicine guideline recommends proven therapies like CPAP and oral appliances, and the Annals of the American Thoracic Society highlights positional therapy for the right patients. You deserve sleep that is quiet, safe, and restorative. Focus on fixing the cause. Clear the nose, manage weight, use evidence-based devices, and get evaluated when symptoms point to sleep apnea. Disclaimer: this video is educational, not medical advice. Your turn. Which sleep topic should we tackle next? Comment below with your questions, and we will build our next deep dive around you.